This whole adventure of diagnosis started and went on for a year and a half. Even being a physician, I never really thought that I had a pancreatic problem. We started working up with colonoscopies, going to cystoscopy, putting me on BPH medication and seeing if that would help. Nothing. Of course, went through all the GI x-rays known to man and endoscopic camera evaluation of the GI tract, which showed some mild inflammation periodically. So it was just because nobody could come up with a diagnosis, and I kept on having this pain. We went on one of the anti-inflammatories for inflammatory bowel disease, and that was included after an MRCP of the pancreas, which was also normal. That really interestingly took away the pain. I took it 3 times a day and the pain was gone, but I just didn't feel right, and eventually started losing some weight, and my energy went away and the fatigue was there, but the pain was basically gone. So immediately we just did a CAT scan, and there it was in the tail of the pancreas, about 4 or 5 centimeters in size. We scheduled a endoscopic biopsy. Eventually that was done about 6 to 8 weeks later and showed the carcinoma, which now had increased to about 9 centimeters. I prepared for the death that everybody was telling me I was going to have in about 6 to 9 months mentally. Saw the oncologist, and he gave me the typical pancreatic cancer spiel of, well, we don't know, but I think there's might be some little nodules in your liver, but they're kind of like plus or minus, but you have plenty of spread into the lymph nodes. You're not a surgical candidate, and you're a general surgeon, you're a doctor, you know what that means. That means that, you know, if you've got a year, you're lucky, and we can offer you some chemotherapy agents, but they really aren't that effective, being honest with you. So my daughter-in-law comes up with, well, how about Abraxane? I just heard about this actually yesterday from a friend of mine, and she repeated the whole story of how this happened. So he said, well, yeah, I guess we could try Abraxane. Rather immediately, probably within a month, I could feel a better well-being about myself, got stronger, et cetera, and I didn't have a lot of the side effects, of course, or very minimal side effects of the Abraxane gemcitabine treatment. After the first, let's say 2-3 treatments with the Abraxane, the questionable lesions in the liver totally disappeared. You didn't see anything in the liver for quite a period of time. In fact, at one period of time, maybe a 1.5 centimeter lesion remained in the pancreas itself. All the lymph nodes were gone. Any lung metastases were gone. I really felt better after we started the treatment. So I really was very optimistic that this might add a few years to my life. I didn't think I was going to live forever, but I thought, you know, maybe I could add, you know, maybe even a couple of more years. I am now 5.5 years since diagnosis. So I guess almost 7 since I started getting sick. Oh, I think it's been great all the way around. I think my care has been really excellent. I have a really good friendly relationship with them. See them all week, I know them all. They all are very interested in my progress, and yeah, I think it's a great team is all I can tell you.